everyone. So today we will be presenting Sex Education for Public Schools by Tran, Amy Baldwin, and Sophia Nguyen. So our standards for today: Standard 1, Essential Concepts. Evaluate the safety and effectiveness, including success and failure rates, of FDA-approved condoms and other contraceptives in preventing HIV, other STDs, and pregnancy. Standard 7, Practicing Health-Enhancing Behaviors. Describe personal actions that can protect sexual and reproductive health, including one's ability to deliver a healthy baby in adulthood. And our objectives. By the end of the lesson, students will be able to classify 4 curable and 4 incurable STDs. By the end of the lesson, students will be able to identify the 4 most common ways to prevent STDs. By the end of the lesson, students will be able to compare the effectiveness of hormonal and non-hormonal contraceptive methods by giving 3 examples. By the end of the lesson, students will be able to list 5 steps of how to properly put on a condom. So why sex education? Growth, development, and sexual health is one of the mandated health topics for public schools in California. Sexual education has always been an important topic. However, it's not an approachable one. It's a sensitive subject, therefore students, especially at the ages of 10 to 14, usually feel uncomfortable bringing up a conversation when they have questions related to sexual health.
So what is sexual orientation? Sexual orientation refers to a person's pattern of sexual attraction to men, to women, or to both. And many teens may first develop an awareness of their sexual orientation because of hormonal changes during puberty, which can trigger new feelings of sexual attraction.
Alrighty, next up, we're going to watch a video on tips for safer sex and pregnancy prevention.
Hello there, I'm Dr. Mann, and I'm here to help you all learn about different methods of protecting yourself from unwanted pregnancies and sexually transmitted infections, also known as STIs. Some of you may be starting to think about sex or having sex. All of these feelings and urges are perfectly normal, and it's important to understand the variety of options you have to protect your sexual health. Your first option, and the most commonly used, are condoms. There are 2 types of condoms, external and internal. Unlike many other forms of contraceptives, condoms reduce the risk of STIs as well as unwanted pregnancies. Both condoms serve as a barrier to prevent semen from entering your partner. External condoms do this by covering the penis, and internal condoms are inserted into the vagina or rectum. You can find external condoms at any drugstore or health clinic, and internal condoms on websites, local pharmacies, and health centres. It's important to keep in mind that the external condom and the internal condom cannot be used at the same time. But wait! There's more. Behold, the ring, the patch, and the shot. All of these contraceptives prevent ovulation, but also require a doctor's recommendation. Each of these contraceptives are effective for different lengths of time. The patch just sticks to you, allowing the hormones to be absorbed through the skin. The ring is inserted into the vagina to release hormones. And the shot injects the hormones directly into your bloodstream. So much information. Here we have the pill. The pill is like a medication taken once a day, every day, around the same time. They release hormones that stop ovulation and require a doctor's prescription. The options, they keep coming. There are 2 types of long-acting reversible contraceptives: IUDs, intrauterine devices, and implants. IUDs are small T-shaped devices that can consist of plastic, hormonal, or copper non-hormonal options. IUDs are inserted into the vagina and planted into the uterus. This device stops eggs from being released monthly and can last up to 3 to 12 years. The second long-acting reversible contraceptive is the implant. The implant is a small, flexible rod that is inserted under the skin of your upper arm. It releases a hormone that prevents the ovaries from releasing eggs. Both of these contraceptives require a doctor to insert them and can be removed at any time. Wouldn't you know it, there's even more. Withdrawal, also known as the pull-out method, involves removing the penis from your partner before ejaculation. However, keep in mind withdrawal is one of the more risky methods of contraceptives with much room for human error, which can cause unwanted pregnancies. Withdrawal also does not protect you against STIs. That's risky business. Only one more to go. If you don't feel like you're ready to engage in sexual behaviors, that's okay. You can always use abstinence and say no. Even if you've had sex already, you can choose to remain abstinent thereafter. Now that you're knowledgeable of the various forms of contraception, you're better prepared to protect yourself from STIs and unwanted pregnancies. If you have any questions about these contraceptives, talk to a trusted adult or your healthcare provider like me for more information. Stay safe out there.
Alrighty, now that we have watched the video, we're going to go through some discussion questions. Number one, were you aware of contraceptive methods other than condoms before watching the video? And number two, what were the thoughts after being introduced to many more options of birth control? Our table of contents for today will be number one, pregnancy, number two, contraception, number three, STDs, and number four, references. Number one on the list, pregnancy. What is pregnancy, you might ask? Well, pregnancy is the process by which the fertilized egg develops into a baby, while conception is the process by which the sperm from the male penis fertilizes the egg in the female fallopian tube. When the penis enters the vagina, the sperm travels through the female reproductive system to fertilize an egg. Therefore, using the withdrawal method is highly risky since a single sperm cell is capable of causing pregnancy. Teenage pregnancy. At 57 pregnancies per 1,000 girls aged 15 to 19, the US has a higher incidence of teenage pregnancy than most other Western countries. Some of the reasons are disrupted family structures, poverty, and lack of education. Many parents and schools attempt to persuade teenagers to avoid sex when educating them about sexuality, but forget to teach them how to have safe sex.
So next is contraception. Contraceptives are nowadays more accessible and more affordable. There are numerous options of contraceptives for all sexes. And these are some of the most common non-hormonal contraceptive methods. So the diaphragm is 88% effective. The copper IUD is over 99% effective, and the male condom is 82% effective. And these are some examples of hormonal birth control methods. So first we have the contraceptive pill, which is 91% effective, the hormonal IUD, which is over 99% effective, and the vaginal ring, which is 93% effective. Shaming and consent. It's okay to have sex. All consensual and safe forms of sexual practice between adults should be supported. It's okay not to have sex. It is their personal right to choose if and when they have sex and who they want to have sex with. It's not okay to insult another person for their sexual practice. What a person chooses to do with their body is between that person and their consenting partner. Other people's judgment is not necessary and not wanted, as long as people, obviously at the legal age, engage in sex and enjoy it wisely, responsibly, and appropriately. And here are some of the characteristics of safe sex. Clear communication between consenting partners, high self-esteem, ability to set boundaries and decline sexual involvement verbally and non-verbally, ability to express attraction, friendship, and affection in non-sexual and healthy ways, and most importantly, use of contraceptive methods.
Okay, so next up is STDs. These are some statistics about teen sex. Among US high school students surveyed in 2019, 46% of students did not use a condom last time they had sex, and 10% of students tested for HIV. It is concerning that 12% of teens out of the 38% of high schoolers have had sex before don't use any contraceptive method or birth control to prevent unwanted pregnancy. And it is very sad to hear that teenagers account for over half of the STD cases per year. There are 8 types of STDs, and out of these 8 types, there are 4 curable and 4 incurable types. The symptoms of STDs are usually unusual discharge from male or female genitals, sores, itchiness, redness, and painful or frequent urination. So how do we prevent STDs? Antibiotics can treat STDs caused by bacteria or parasites, which are the curable STDs. But there is no cure for STDs caused by the viruses, which are the incurable STDs such as HIV/AIDS. But there are medicines that can often help with the symptoms, and there are behaviors that we can change to lower our risk of spreading the infection and prevent STDs, including abstinence, vaccination, condoms, and monogamy. There are specific steps on how to properly and effectively put on an external condom or a male condom to prevent STDs and unwanted pregnancies. So let's watch a short video on that.
Okay, so we have regular size, extra large, latex free, thin feel, intense feel, okay. Strawberry, wait a minute, why do they need a strawberry flavor balloon? Someday, what may seem unbelievable now will likely happen. Someone will agree to have sex with you. Congratulations. Hey, didn't you forget something? Yes, that's important too, but I'm talking about condoms. It's a good idea to use condoms when you have sex. Condoms are an effective method for preventing pregnancy, as well as HIV and other STDs. Okay, I see that you need some help. Let me give you some tips on how to properly use a condom. Check the expiration date on the condom package to make sure the condom isn't expired. Open the condom package. Never use your teeth, scissors, or any other sharp object. You may rip or cut the condom. Before sex, take out the condom. It should look like a little hat. Then hold the tip of the condom to remove any air, and then roll the condom down to the base of the erect penis. The condom should roll easily. If not, it may be inside out, and you should throw it away and get another one. Use each condom for only one sex act. After ejaculation, withdraw the penis while it is still erect. Hold on to the base of the penis to keep the condom from falling off. Remove the condom, tie a knot in the end to keep the semen inside, wrap it in a tissue, and throw it in a trash can. Condoms come in different shapes and sizes. There are also different colors and textures. It's important to find a condom that is comfortable for you and your partner. Some condoms have lubricant to make them more comfortable during sex, while others do not. Non-lubricated condoms can be used with water-based lubricants, such as commercial lubricant you can buy in the drugstore near the condoms. Never use Vaseline or other oil-based lubricants, as they will break down the condom. Condoms can be purchased at many stores, including pharmacies and grocery stores, and even in some gas stations. There is no minimum age a person needs to be to buy condoms, or maximum. So if you're lucky enough, the first time you have sex won't be the last. Remember to always be responsible, protect your health and that of your partner, and always use a condom.
Oh, this is the last time I send Jim to buy balloons. Till next time, don't forget to visit me at amaze.org or go to. Okay, so we have regular.
Okay, so to sum it up there are basically 5 steps to the process. So step 1 is to always check the expiration date on the package and make sure the condom is not expired for the best effectiveness. Step 2 is to open the package. Using teeth, scissors, or any sharp object is highly unrecommended. And to make sure the condom stays the same and is not ripped, carefully tear the package by hand and remove the condom from the wrapper. Step 3 is to remove air and put it on. So to do this, hold the tip of the condom to remove any air, place it on the head of the erect penis, and then roll it all the way down to the base of the penis. Step 4 is after ejaculation and pulling out. After sex, withdraw the penis while holding the condom at the base to keep it from falling off. And the last step, step 5, is to dispose the condom after one sex act. So carefully remove the condom and then tie a knot at the end to keep the semen inside, then wrap a tissue around it and throw it in the trash. There will be guided practice and check for understanding, which is a group work. So the steps of how to put on a condom will be demonstrated on a banana, and each group of 3 to 5 students will observe the process. And then all members of each group will work together and write down the steps of how to properly put on a condom in the correct order and on a blank sheet of paper. And then later, volunteers will perform the process to get extra credit. There will also be an independent practice as well. A take-home quiz will be given out. The questions are going to cover safe sex and contraceptive techniques, as well as the processes for putting on a condom. In the next class, all students will be turning in the quiz at the beginning of the class, and the quizzes will be graded, and then the materials will be reviewed if necessary. And there are some sample questions. The first one could be, what do hormonal forms of contraception help to protect against? Number 2 could be, which of the following can be used to prevent STD transmission? And another question could be, which of the following types of contraceptive methods help prevent STDs? And that is the end of the lesson. And thank you so much for your participation.